So I'm back. I'm back with Dr. Filidei. And Dr. Filidei is our functional medicine doctor here at the Amen Clinics. But I want to talk to you today about something that a lot of people ask me about because I cover a lot with nutrition and what I do. And that's how I first met you, was actually at one of the conferences.
Right.
And so I want to actually go over that with you.
Sure.
So I often tell people, if your gut's not right, your brain's not right. And that's true. Right? So
Absolutely connected.
We're always trying to get people to heal their gut. But if they're having trouble digesting food, if they have something called GERD, which people write to me about, and they are taking lots of medication to decrease their stomach acid because of their acid reflux, they're going to have issues. So let's talk to them about what that means and what they could do differently and why that might be affecting mental health. Right.
So the whole topic of GI, gastrointestinal issues related to brain health is hugely important. Cannot overstate that. Your gut literally runs your brain and your immune system. So 80% of your immune system is here in the gut.
Yeah, that was shocking to me. It's like the second brain.
Amazing. Yeah, exactly. So if you have an autoimmune condition, you got to look where your immune system is. It's here. So GI health, really important. And I pay a lot of attention to that, and we can test it. Now, the thing with GERD, which is gastroesophageal reflux, disease, heartburn, right? Most of us call this heartburn. If you go to your doctor and say, I have GERD, heartburn, they're going to put you on a drug to lower your stomach acid, a PPI, proton pump inhibitor, some kind of antacid. Now, that's not a good idea because you need acid. The acid is there for a reason. It kills bad guys. Nothing we eat is sterile. So when you're eating food with bacteria in it, if you lower your acid, you're literally lowering your defenses. You're letting the guard down.
Right.
And so you can get bacteria in that shouldn't be there, kind of bad guys. So that's one problem. And also you need acid to digest things.
You're not getting nutrients,
there for. It digests things, activates your enzyme. Enzymes are activated by acid. So if you have low acid, your enzymes don't work well. So you're going to get digestion issues, absorption issues.
And you won't absorb those nutrients.
Deficiencies, yeah. So you don't absorb the nutrition. So, a lot of people are eating normally, but they're just not absorbing their food.
And this is something I had heard, maybe you can clarify this. So along with that, as you're not digesting your food and as you're not getting these nutrients, I have heard you get small bowel overgrowth and you don't form vitamin K. Some of the things that are formed in your intestines don't start to happen, and you need that to happen. Is that correct?
Right. So the small bowel is not supposed to have bacteria in it.
Right.
Again, so if you're lowering your defenses and the bacteria get into your small bowel, in fact, that's confused a lot with GERD. It's not really GERD. It's SIBO, which is small intestine bacterial overgrowth.
Right.
It can come up from either end. Usually it's from this end down. And so you got to start getting heartburn and bloating after meals. And there's not supposed to be bacteria in there. So that is symptomatic and problematic for your entire GI health. You can lead to leaky gut syndrome, which again is leaky brain too. Leaky gut, leaky brain. You always got to connect those. So a problem here can cause mental health problems.
Right.
And so the PPIs, the proton pump inhibitors, are supposed to be short-term use, a couple of weeks. If you have a surgery, you want to keep your acid, and they end up on them for years, right? No one ever takes them off because they're supposed to be on it, they think.
Right. It's interesting. Yeah. I remember the first time many years ago that I had issues, because I had a lot of gut issues, lots of gut issues. And I went to someone, I just, by chance, ended up with a naturopath. And rather than a PPI, they suggested that I go on digestive enzymes, and they actually were supposed to actually increase or improve the acid, which to me sounded bizarre, counterintuitive.
Exactly right.
But that's what they explained.
Right, and that's what I'll do with my I try to get everybody off of those. Now, sometimes there's a few rare conditions where you need to be on it. Something called Barrett's esophagus is precancerous. You need to be on for about a year. But outside of that, almost nobody needs them. But they say, well, if I stop, I get heartburn. Okay, well, let's work on your digestion. You actually take acid, not that kind of acid, apple cider vinegar, right? That's an old wives' tale. It works. Some of this old medicine, folk medicine, really works. That's why. You take more acid with your meal and help you digest. You can actually take hydrochloric acid tablets. I guess this is opposite of
That's what
the
they
antacid.
gave me. Right.
You take more acid and you take digestive enzymes. And your GERD can disappear just by doing that. So
now,
much better ways to do it.
Are there some foods that trigger GERD for some people more than others?
Yeah, so there's a diet called a FODMAP diet, which is certain fructooligosaccharides that in some people can really cause a lot of GI symptoms. So the top guns, the top two are onion and garlic. So in some patients, now those are usually actually good for you, but in some patients, that's causing their symptoms. So food reactivity, not necessarily allergies, can certainly play a role. But if you look up the FODMAP diet and see if you're eating a lot of that and avoid it and see if you're better, maybe you're one of those people. Yeah, so that can help some folks.
So it absolutely can trigger things, certain mental issues, depression, or other issues that you might, anxiety, if your gut is not well. And so that's why people end up here seeing you. And so we want to make sure you're doing the right thing, not the wrong thing, and it seems counterintuitive. So if you have any issues, if you do feel like you've got these gut issues, whether it's GERD or whether it is you're just not digesting, or you've got IBS or you've got other issues, people can contact you. And Dr. Filidei takes phone appointments, he takes Skype appointments. We would love to be able to help you out with that. And you can send your questions to me, or you can make an appointment with Dr. Filidei, because I'm going to end up sending you probably through to Dr. Filidei if it's really complicated. So we're going to post a link for you. We can have our care center call you, or you can contact them directly. So thank you so much. Is there anything else you want to add?
My pleasure. Well, just again, I just can't overstate the importance of GI health. You know, the gut feeling you get, they're directly connected. Butterflies in your stomach, anxiety, you feel it here. IBS is a psychiatric issue. Anxiety causes you to have loose bowels or constipation. So it's really a direct connection. Neurotransmitters are made in here that affect your brain.
Up to 80%, right?
So again, really important area to have healthy.
So what about probiotics in this equation?
So probiotic can be very helpful. There's multiple different brands. We have one here directed to brain-specific issues. So, and you really can't take too many. There's trillions.
Because a lot of people ask that question.
Yeah, I get that a lot. Like, what's the best probiotic? In reality, they're all kind of transient. It turns out these things don't really colonize and stick around, but a good one for a long-term basis will help push the things to on the good side. So I do a lot of stool testing to see kind of which probiotics you have. I'll have people come in on probiotics, and there's nothing at all showing up on their test. So whatever they're taking isn't working.
Oh, interesting.
So we can actually check and see if you're taking a good one or not. So you kind of get ideas of which ones are better than others.
That's sort of fascinating. So interesting, just side note really fast, our dog, Aslan, so he's just the most sensitive creature on the planet in every way. He's the sweetest thing, but just crazy. We've had more issues with him with food. So even on high quality dog food. So he has to eat a completely raw diet. It's the only thing he can eat is a completely raw diet, 5 ingredients, no grains. So it's raw meat with sweet potato, cranberries, blueberries, and kale. That's what's in his food.
Which is not a bad diet for a dog.
Right? Anyway, it's not a bad diet for anybody, right? So, but other than that, he gets really sick and he gets all sorts of problems. They wanted to do the recent thing, they wanted to do a double knee replacement. He ripped open his back again for the second time when we tried to switch him back onto a high quality dry food. And he has ear infections and all sorts of problems. So all this inflammatory reactions. So we put him back on the raw food, cleared up within 2 weeks. He's running around like a puppy, definitely does not need a knee replacement. But the hair wasn't growing back because the vet had given him steroids to calm down the reaction.
Shut it down.
So that it just literally, he went bald. And so it wasn't growing back. And then I realized, wait a minute, he's been on antibiotics now long term because of all this craziness going on. They couldn't figure out what it was. And so they put him on multiple antibiotics, which they do to people, right?
Sure.
So it occurred to me, I'm like, wait, what would I do with a person? So just like I put him on the raw diet, I then went, oh, okay, I need to give him fish oil and probiotics. Now you can't give a dog the same probiotics you give a person, so I gave him dog probiotics. But the fish oil, I couldn't give him dog fish oil because he's so sensitive, he was like allergic to what was in the dog's fish oil. So I gave him our fish oil. No joke, 2 weeks his hair was growing back. And it's just now it's like he's got an amazing coat again.
Yeah, so a great anti-inflammatory,
right? He needed an anti-inflammatory and he needed to recolonize his gut.
Right.
So, I mean, it's amazing to me. We think about these things sometimes for our pets, but we don't think about doing it.
Oh, I know. Yeah, this happens all the time.
Right?
In fact, this whole thing, well, we'll get into a different talk, but mold is another thing. It turns out that the animal industry has this down to an absolute science. They know all about mold, mycotoxins in animals, in chickens and pigs and cows. And we
But we don't believe it.
Not for us.
Right, and they
We
think
don't
it's a
have it.
myth. So,
Right. So
we need to do another vlog on that.
that would be a big one.
Okay.
Because I do a lot of that.
So any gut issues, reach out to Dr. Filidei. We are going to post a link, and you can either call our call center or we can have someone call you. Thank you so much.